Who do you know with acid reflux? So that is the question today. This is Dr. Dave Yachter, the chiropractor. I want to thank you for joining me today in this special episode of our condition of the week. And in this episode, you'll discover the cause and the cure for GERD and acid reflux. We're going to discuss the most critical factors when it comes to understanding and avoiding this uncomfortable and dangerous condition. And the reason why this is important is because the symptoms of gastroesophageal reflux disease, better known as GERD, occurs in approximately 14 to 20% of the population on at least a weekly basis. So chances are you've either had it or at some point will likely experience it. So acid reflux is basically the term used when acid in your stomach backs up or refluxes into the esophagus where it doesn't belong. And the difference between acid reflux and heartburn is that acid reflux is the action and the heartburn is the feeling. And the movement of the stomach acid into the esophagus is the acid reflux. And the burning feeling caused by this action is the actual heartburn that you feel. So the most common symptoms of acid reflux is heartburn, but it's not the only one. You may not even experience heartburn when you're suffering from acid reflux. Another common symptom is regurgitation, or the feeling of acid backing up in your throat. And this can cause a sour or a bitter taste in your mouth. And you can also experience like what they call a wet burp or even throw up. Reflux by itself is not at all unusual. GERD, on the other hand, develops when acid reflux happens 2 or more times a week and produces very troublesome symptoms. If it's left untreated, GERD can lead to serious health problems. And besides the pain, throat ulcers, tissue abnormalities, it can affect your quality of life, ability to swallow, breathe, and even speak. And if it's not managed properly, the damage actually increases your risk of developing certain types of cancers. So this can be very serious and very dangerous. So with seeking treatments, obviously when you have to go to a doctor's office for the initial visit, you could be looking at up to $200 or more just to sit down, have a consultation, have it diagnosed properly. And then, of course, medication is typically the first line of treatment. But surgery and other procedures are generally used if the drugs don't help. The prescription drugs to treat a GERD condition, these drug prices vary depending on the dose needed, how frequently the drugs need to be taken. But according to the Agency for Healthcare Research and Quality, prescription GERD drugs typically cost, on average, $250 to over $400 a month, especially for the brand name medications that we all know, like Zantac and omeprazole. So those are the more common ones. But the side effects from some of the prescription drugs are really eye-opening. And some of you have spoken to me about this, and I know this for a fact, that these are real events that occur from these medications. Besides headache and abdominal pain, in many cases, it can lower your magnesium levels, which causes heart problems. It can cause fast or slow or irregular heartbeats, persistent muscle spasms, even seizures, signs of lupus, things that look like lupus, which could just be rashes and can be even misdiagnosed, along with joint pains. Proton pump inhibitors, such as the drug omeprazole, are a known cause for vitamin B12 deficiency. So think about this, B12 being so important for your immune system. And during this pandemic, that concerns me. I don't know about you, but I want my immune system working at or near 100% capacity. So we definitely have to consider some of the prescription drug medications and how they predispose us to have other certain health conditions. And this is just one of those examples. The risk is increased if some of these prescription drugs are taken every day for a long period of time, like 3 years or longer. So that's another concern. The longer you're on the medication, the higher the risk of these side effects and other conditions developing. Some of these GERD medications actually increase the risk of bone loss and bone fracture. And that's why, if you're on these medications, it's so important to take a calcium supplement. Further along, if the medications don't remedy the condition, surgery may be an option. And, the most common surgery for GERD is something called a fundoplication. Yeah, I wish there was a better word for that. But that's what the surgery is called, in which the upper part of the stomach is actually wrapped around the esophagus and surgically stitched into place. And that does not sound like such a fun procedure, but nonetheless becomes an option for some people if they don't know what else to do. According to the Comprehensive Center for Laparoscopic Surgery, hospital charges for fundoplication are on average $25,000 or more for this particular type of surgery. And even if you're covered by insurance, you're looking at your co-insurance anywhere from 10 to 40%. So you're looking at out of pocket for that, even if you have insurance, $2,500 to $10,000 for this one particular procedure. So, it just seems, based on, some of these situations where people are taking the over-the-counter or the prescription medication for many, many years, or have to go for a surgery and then still have to take medication on top of that. It just seems like the lifetime cost to manage this type of condition could be at least $100,000, maybe even several $100,000 in many cases. This is very, very common. And the side effects of the surgery after you have that is not being able to burp, belch, or vomit. And this means that you have more bloating and flatulence after acid reflux surgery. So not ideal if the problem can be solved without drugs and without surgery. That's a means worth exploring. I'm sure you would agree. So according to the Mayo Clinic, this is interesting what I found, that patients who experience acid reflux may be able to curb the symptoms with lifestyle changes. How about that? Such as losing weight, eating less, avoiding alcohol and nicotine. Another interesting finding is we know that food sensitivity issues can cause or contribute to acid reflux. And in addition to that, leaky gut syndrome. So in our office, we have protocols to correct this. And some of you listening right now are taking advantage of that. You're on a gut protocol and seeing great results with that. So that is, in fact, an option to explore first and more conservatively before taking medications or exploring surgery. And then another thing to look into, obviously, is proper nerve supply. Is it a possibility that there could be subluxation in the spine, interfering with proper nerve supply, going to the stomach and causing GERD or an acid reflux condition? How is that possible? Well, the nerves in the middle and the upper part of the back branch off from in between that part of the spine, and they go into innervating and controlling the stomach and the production of the acids, and also the swallowing and the digestive process. And if the spine is out of alignment in that area, if you have a condition called subluxation, that's where the vertebrae misaligns and it puts pressure on the nerves, it interferes with the communication from the brain going to those tissues, which would otherwise control normal function. Now, obviously, if there's an interference there, you don't have normal function, you have malfunction, which could cause or contribute to GERD or acid reflux. And I've seen this many, many times where that is the cause. And when we adjust a person, they actually respond and their symptoms disappear because their body heals and it functions the way it's supposed to. I'll give you an example. I'm going to read this testimonial. A few years ago, Mary came in and she said, before receiving chiropractic care, I had pain on my right side for 10 years. I've not been able to sleep on my right side, and whenever I tried to, the numbness on that side woke me up. The pain was so severe on my legs that it caused my ankle to swell. And my doctor prescribed compression stockings, which I had to wear every day. As a result of the pain, I had migraine headaches at least once a week. Lastly, she said, I've had frequent heartburn due to acid reflux. Initially, I thought chiropractic care was for people with injuries due to accidents, she said. Since coming to your office, I know that chiropractic care aims to correct the misalignment of the spinal cord, and this is the main cause of most health problems. She says, since receiving chiropractic care, I've seen a lot of improvement. The pain on my right side has greatly subsided, enough that I don't have to wear compression stockings anymore. I've not had migraine headaches since started care, and I'm also starting to sleep on my right side, and my heartburn has also improved. I would highly recommend chiropractic care to my family and friends. So this is one typical example of somebody with a great story, a great success story of approaching a health condition with a more conservative mindset. In some cases, there's an indication for medications, for surgery, and if that's an option, or if that's something that people want to seek, then sometimes people get helped with that. But from my perspective, I have seen a lot of people do really well and get great results and be very happy that they didn't have to take the risk that comes along with harmful side effects from prescription drugs or the risks that come with surgery. So from that aspect, again, I would ask you, who do you know with this type of condition, with GERD or acid reflux? Because as we said in the beginning, statistics show that 1 out of 5 people we know are dealing with this. And it's a lot more common than you and I would think. So if you know anybody with this condition, ask us what we can do to help that person. Ask them if there's a way that we can connect with them, reach out to them, or if you would like to do that, we'll show you the best way to help them get help for themselves. Thank you so much for joining me today. I love and appreciate you. God bless.